We're trying to look at the differences between nosocomial pneumonia or hospital-acquired pneumonia and community-acquired pneumonia. So before we go into the lecture, let me just tell you guys what I understand about this concept. Nosocomial pneumonia is a type of pneumonia that you acquire from the hospital. Like, let me say a patient had a different disease condition, they visited the hospital. Then unfortunately, they got in contact with these microorganisms that cause pneumonia. So they developed pneumonia, right? So from the history taking, the patient will always tell you that, okay, they visited the hospital not long ago and all the stuff. So they start suspecting. Then for the community-acquired pneumonia, it's more of like the pneumonia was just due to an exposure in the community. As simple as that, right? But we are doing this lecture so that at least you just know how to arrange it. So ventilator-associated pneumonia too is also a nosocomial type of pneumonia, all right? So for the nosocomial, also known as hospital-acquired pneumonia, and also the community-acquired pneumonia, talking about the differences now, we'll be differentiating them based on different criteria. So for the location, hospital one is acquired in the hospital. Community is what? Outside the hospital. As simple as that. You mustn't say in the community, just say outside the hospital. All right. So it's outside the hospital or any healthcare facility you acquired the pneumonia. Then for the causative pathogens, for the hospital acquired pneumonia is usually from what those organisms has been in the hospital. They have been resisting drugs in the hospital. So they are usually crazy. They are known as the multi-drug resistant organisms. So they are usually crazy. So and this other one now, the community one, is just caused by normal group of guys and all that. So it's caused by what? Streptococcus pneumonia, Haemophilus influenzae, and Moraxella or catarrhalis. Okay. The risk factors. Hospital-acquired pneumonia is associated with mechanical ventilation, prolonged hospital stay because what? The organism is multi-drug resistant, so it will take time. That's if it gets cured at all. All right. Then okay, sorry. Risk factors are like, okay, things that are causing it, things that are predisposing you to it. Okay, that means maybe you have stayed in the hospital for a long time. If you have other underlying medical conditions, so your immune system is weak. Okay. Then community acquired pneumonia is usually associated with things like age, underlying medical conditions, and lifestyle factors. If you smoke, all right. Then severity. Hospital acquired are more severe because what? The organism is what? Multi-drug resistant. This one is mild. Okay. Treatment. Because you are dealing with an organism that is multi-drug resistant, you have to use a broad spectrum antibiotics, right? Then community acquired is typically associated with just narrow spectrum antibiotics, right? Then prevention. This one is focused on infection control measures, hand hygiene, and all the stuff. Then for the community, emphasize vaccination. Then people should stop smoking and encourage healthy lifestyle habits. So these are the differences between what? Nosocomial or hospital acquired pneumonia and community acquired pneumonia. That's it. Bye for now.